My name is Dr. Sidney Gisharu. I am a refractive surgeon from Dallas, and I will be given an update on SMILE vision correction, and in particular, an update on the new VISUMAX 800. I became involved with SMILE in 2017, and it's been a great procedure for us. The way I got involved was at the time I happened to be doing a lot of speaking engagements in Asia. And in 2014 in Tokyo, I first heard about SMILE. By 2016, I was hearing raving reports about SMILE with the VISUMAX 500. And at that point, I actually ordered my laser sight unseen. I am an advisor for Zeiss. We all go to a lot of these meetings, and there'll be various people at the podiums. Some people will be pro LASIK, some people are pro SMILE. So in those cases where there's a difference of opinion, I always believe that it is best to look at clinical studies. Zeiss actually has a SMILE clinical compendium that you can actually look online. And it has various studies comparing LASIK to SMILE. On the screen, you'll see two studies that I like. The first one basically compares SMILE with the VISUMAX 500 to LASIK with Contura. And essentially, when it comes to safety, when it comes to 3-month best corrected visual acuity, gain or loss of vision, and visual recovery at 1 month and 3 months, there really are no significant differences. But where there are differences has at 1 day and 1 week, and their LASIK has a slight edge. Now, for those of us who've been performing SMILE for a long period of time, and we've kind of perfected our laser settings and our technique, those differences are actually much smaller. Now, where SMILE shines is with high myopes, and you'll see that on the lower study. And at 6 months, again, on this study, they were showing a slight advantage with SMILE achievement of UCVA of 20/20 compared to LASIK. And that's really what we see in our clinic anecdotally. SMILE. So introducing this year, the VISUMAX 800, that's the laser on my right, compared to the VISUMAX 500, the old laser, which is to my left. In terms of differences, the VISUMAX 800 is just a simply faster laser. It does the ablations much quicker than the VISUMAX 500 does. In terms of design, the patients really have liked the fact that the VISUMAX 800 has open design. This is relative to the VISUMAX 500, which has more of kind of like a MRI kind of design, which in some patients can make them a little bit more anxious. Other improvements include the fact that we now have vertex centration. We can actually center the treatment a lot more accurately than we could with the VISUMAX 500. One thing that we will talk about here in a few slides is the risk of needing to convert from SMILE to LASIK. That can happen during SMILE if you have suction loss during a critical time of the procedure. These events are rare, but the VISUMAX 500 actually reduces the risk of this. So in terms of US studies for the VISUMAX 800, we're really going to have to wait to kind of get more of those studies. On the slide presented, you can see an international study that basically showed great results with the VISUMAX 800, especially with high myopes. This is another study, another international study comparing the VISUMAX 800 and the VISUMAX 500. And again, here we're not seeing, we're seeing a lot of similarities in terms of results. The one thing of note is that they saw less higher order aberrations with the VISUMAX 800, and that probably has to do with central line, which allows us to adjust for vertex centration. In this study, they also had oculine, which adjusts for cyclotorsions. We do not have this available in the US. So in terms of, going back to suction loss, we said that in rare SMILE cases, if the patient moves their head or in another way creates suction loss, that this can be problematic. In most cases of suction loss with SMILE, it's not a big deal. You just reestablish suction and commence with your SMILE procedure. But in less than 20% of patients, if that suction loss happens during a critical time of the procedure where the laser is making the lower lenticular cut, which we call the refractive cut. It makes a lower cut and then also an upper, but the lower is the one that's more important. But if that happens during that phase, you can develop suction loss that you cannot recover from. And in those situations, you have to convert to from a SMILE case to a LASIK case. Now, these cases are extremely rare. In our practice, between my partner and I, you're talking about maybe 1 in about 800 to 1,000 cases. And in the majority of those suction loss cases, you're able to continue with SMILE, but around 20% of the patients you have to convert to LASIK. Dan Weinstein, who was one of the pioneers of SMILE, anticipates that due to the speed of the VISUMAX 800, suction loss rates will be reduced by a full 65%.